Welcome back, folks. We're going to do a wee bit of instruction on the use of a defib now. You've probably seen there's a proliferation of defibs around the country. It's a great thing. They are lifesavers, they've been proven to be such. You don't need training to use one, although it's better if you do get some instruction on it, but because it talks you through it, and I'll prove it to you just as we go through. Essentially, if you've got a casualty who's not breathing, you're phoning an ambulance first, you're doing your CPR that we showed you earlier on, and then trying to get these pads on the person as quickly as you possibly can. So you might find them in a supermarket, you might find it in a gym, maybe a railway station, other transport hub. They're on Caledon, McBrain's ferries, for example. So you'll find them all over the place in communities. You can find them in villages and towns throughout the country. We supply them to various different small communities around Ayrshire, Dumfriesshire, and into Renfrewshire. So ultimately, they are lifesavers. So this one here is called a LifePak CRT. The CRT is made by an American company, Physio-Control. So it does talk in a slight American accent, but the instruction's the same. They all have to work roughly the same way. So you're doing manual CPR, you've phoned the ambulance, and then somebody brings this to the casualty. So what we do is we switch it on. We switch it on, okay, and ultimately it should start talking to us.
Now.
Okay, so
Remove all
if you zoom in
clothing
on
from
that
patient's
section,
chest.
okay, I come back again, that's fine. So it's telling me to remove clothing from the patient's chest. You need to have a bare chest, okay? Once,
Red handle to open bag.
see, it's telling you what to do. So normally these would be in a bag,
Look
which
at
is sealed,
pictures on pads.
but because they
Peel
are
one pad
a training
off blue
situation,
plastic.
and this works exactly
Apply
the
pad
same way.
to bare skin, exactly as shown in the picture.
So this one goes under
Press
the
pad
arm.
firmly. Peel other pad off blue plastic.
Okay.
Apply pad to bare skin, exactly as shown in the picture.
Okay.
Press pad
So
firmly.
I'm just going to come out the shot.
Remove
back
all
in.
clothing from patient's chest.
Because I've got
Do
a remote
not
control
touch
here.
patient.
Don't be looking for this on a real one.
Evaluating heart rhythm.
So it's analysing the heart rhythm within 11 seconds, okay,
Stand
as soon as the
by.
pads are on.
Preparing to shock.
So it's got a button here, okay.
Everyone
You must be clear of the
Press
casualty.
flashing button. Shock delivered.
Shock delivered.
Provide chest compressions and rescue breaths.
So it's telling you to do your normal things, which are chest compressions and rescue breaths as per your training, and it'll keep on going. The types of things you have to be careful of or with this particular machine is metal. So if there's any metal on the body or near where the pads are, it can interfere with the readings. You shouldn't be touching the casualty because again, it might feel your pulse or your heartbeat and it thinks the casualty is okay and it won't shock. It determines the level of shock that goes into the body.
Continue care.
You can't change, there's no dial on this, you can't override it in between shocks. So it's fully automated from that point of view. Some of them you don't even have to press a button. So they are amazing pieces of kit. You have to make sure the pad's in the right place. If it so happens that the pads are not in the right place, the machine will tell you. Okay, so it's worked that out. If the chest is very hairy, there's even a shaving kit that comes with it. So you can shave the hair so you can get that directly onto there. If anybody's got a nipple ring or something like that, that might have to come out or the pad move further away. They've thought of everything in relation to these, and it will only shock when it has to. And I'm just biding time here because very shortly, this is actually going to interrupt me. All this time we should have been doing chest compressions, rescue breaths, chest compressions, rescue breaths. A pacemaker is embedded up here underneath the clavicle or near the clavicle, so it's far enough away from this pad, so it won't actually affect the use of the defib. They are without doubt the most advanced things that we've got nowadays to save somebody's life. Over 90% success rate to bring somebody around. So get this on as soon as you possibly can. and you don't need training for it. If you just have a close-up on here, Sasha,
Do not touch patient.
you'll see there's instructions in the inside.
Evaluating heart rhythm.
So back up again. So it is
Stand by.
started to do another check.
Preparing to shock.
So at various different intervals, it will prepare to shock. Okay.
Everyone clear. Press flashing button.
So again,
Shock delivered. Provide chest compressions and rescue breaths.
so that's essentially it. I'm just going to switch it off just now because I want to just show you one other thing before we finish this part of the session. And that is with regards to, and I'm just going to go out of shot for the time being. In relation to a baby. Now, God forbid that you would have to use a defib on a baby. It might be because they've been electrocuted or they've maybe got born with a heart problem. The pink one goes on the front, okay, and the yellow one would go on the back, okay, because there's not enough room on their torso for them to be side by side. So one goes on the back and one goes on the front, okay. So hopefully that will give you a wee bit of peace of mind if you ever had to use one on the baby, but hopefully that's never the case. Full information on how to use defibs is available from British Heart Foundation, Resuscitation Council of the UK, and also if you want to contact us at I'm Training, we will give you some more support, help in terms of how to train people on using these, even provide them for your communities. Thank you very much. We'll see you in the next part of the session, which we're going to go on to relieving choking, should somebody be choking.